Welcome to another episode of The Disruptors, where we're arming you with the tools you need to innovate within the physical therapy space by highlighting those who have come before you. I'm your host, Stephen Cohen. Now, let's get into it. Welcome back to another episode of The Disruptors, where we're highlighting innovators within the physical therapy community to give tactical advice for those looking to innovate within PT. Today, I'm blessed to be joined by Sean Kinsman. And Sean, I would love for you to give the audience a quick introduction.
Yeah, Steve, thanks for having me on. So as Steve mentioned, I'm Sean Kinsman. I am currently the head of Clin Ops at a small company called Kandu Health. It's a startup in the digital health space that's focused on helping stroke survivors and their caregivers get access to high quality care, particularly in that 90-day post-acute period after they've had the stroke and gone through just that huge life change. So really a crucial time frame for them to get that access. A bit about me. I'm a PT by trade, was trained at Northeastern University. Shout out to the Huskies in Boston. Started my career at health systems. I did some time at Mayo. And then I was at Hopkins for a few years, really cut my teeth on oncology. And for me, I always wanted to just make a difference in humans' lives. Helping people to recover from injury and actually getting quality time with them was kind of the way I fell into PT. And then as I kind of got into it and felt some of the inefficiencies of the system, I really wanted to be an agent for change. So I stepped into, at one point in my career, a multidisciplinary practice that was focused on using telehealth to engage the state of California right at the pinnacle of the opioid use crisis. We started to realize we've been overprescribing for 2 decades, and helping those people that were particularly caught in that system of just being addicted or dependent, unable to resume gainful employment and successfully resume their lives, helping them to do that with telehealth. And this was dark days of telehealth, let me tell you that. This was when we were using Skype, we had Polycom systems, it was ugly. But it created this kind of natural urge in me to make a broader impact and leverage more of these more bleeding edge technologies to really make that impact. So my last role, which is probably my most impactful and biggest passion project, was with a company called Recovery One, where I spent the last 7 years, really heading up their clinical services and operations teams, kind of building out the solution and establishing kind of a new way of delivering care and more of a value-based paradigm. So when you think of traditional care, it's fee for service. So you get paid by volume. And we really were able to jump the curve a little bit and negotiate with payers towards more outcome-driven payments. So are we getting the patient better and getting reimbursements and cost sharing profiles to accommodate those structures in and out of a bundled setting? So it was a really rewarding experience for me to be on the ground and really help build and kind of carve that out. So that's a bit of my journey, probably a bit more than you asked for, Steve, but you brought me on, so it's your own fault.
That's perfect. And I really like the focus on moving into the value-based care arena, especially for PT, right? Because in the fee-for-service model, you're more or less penalized for efficiency, right? That didn't take 8 minutes, so can't bill it. Right. Or, hey, you get 40 minutes for the visit. Right. So, use all 40. I don't know if you are familiar with the Parkinson's law, not the neurodegenerative disease, but it's a different where basically any meeting will expand to fill the time slot of that meeting. Okay. Right. Regardless of the efficiency of it. Yep. And so we've almost forced PT into a Parkinson's law bucket by putting these time, such an important on time spent, right, versus actual care delivered. And so I think there's a lot of opportunity within value-based care. Obviously, you do as well. As you think back to your in clinic and then the transition, right, into the telehealth world, what in the Polycom, that brings back some memories of being in conference rooms and everything else. Was there anything or a set of things you did when you were at Hopkins or in clinic that you think set you up for that transition?
It's a good question, Steve. I probably have a couple answers to that, but I'll titrate it to your first part, which is at Hopkins. So Hopkins, everyone knows Johns Hopkins. Back when I was there, best hospital in the land, still a pretty good hospital. They've fallen a bit since I left. I don't know if there's a corollary or not, but we'll just skip it.
Infer what you want, what you will.
Yeah, you can take that audience and choose what you want. No, the great thing about Hopkins is you get to experience everything. You get to see everything. I you just hit everything you possibly can in terms of patients. You will see every diagnosis, every issue, every permutation that can possibly happen to a human being, and you'll be asked to solve it. One of the cool things that probably really galvanized me the most is I was able to take part in the MICU study at Hopkins. I was right there, right at the crux of when we were doing that. And that was a study that they put out of mobilizing individuals that were medically compromised in the ICU setting. These are people that were sedated, they were vented, they were, impeded by, could be VACs, could be open stomach wounds, whatever it was. Our job was to get them up as soon as possible, and we were testing to see if we had better outcomes. Well, the proof was in the pudding. We were really able to push the bounds and change the way the entire country and, frankly, some of the world operated in getting people mobilized earlier out of that study. So you'll hear the MICU study at Hopkins referenced. I think it came out in 2008, but the work we were doing was 2006 and 2007, and it was great to be a part of that. And that really helped to, at an early stage, enlisted me the drive to push things forward, push things to a point where we can really challenge the status quo, which is not something that happens a lot in healthcare, but particularly PT. I mean, you know this. We're still using walkers that were designed 100 years ago.
We go for a long time on that, but to make sure we're giving value to everybody. Did you have to raise your hand for that MICU study? Or like, how did you get involved in it? And that, I know you've slept a couple times since then, but for those that are thinking about raising their hand or trying to figure that out, like how did you get involved with that study?
For me, it was an adjacency, so you won't see my name on it. So I was supporting it. I was doing some of the testing, and I was on the oncology unit. And this was happening in the medical unit, but we cross-covered. We had some of those patients coming over. So it was me playing a role by proxy more than anything, but it kind of sowed the seed right there. And being able to really, work in that environment with those people that were medically compromised and, what you had learned in school no longer applied. Like you were changing the paradigm. And that to me really was so cool about what you could do there. Now that's, there's other caveats to that, right? Like when you work at an academic medical center, sometimes you get stuck in the kind of minutia of, the bureaucratic, ways in which we do things. But that was a real opportunity that comes along very rarely, and I was able to play a role.
I think there's a couple pieces of advice that I'm teasing out there, and one is to not be afraid, in fact, to raise your hand and put yourself in an environment that's tough, right? Where, you're not seeing the same, 8 total knees in the morning and then 6 ACLs in the afternoon, right? And not there's anything wrong with that, but putting yourself in an environment to broaden your scope and broaden the aperture of what's possible. And I think the second half of that, and to not be afraid of going into environments where school doesn't apply anymore, right? And so that, actually, I want to stay on that for a second, right? Because I would say that what I learned at Kansas State, and even going to do my MBA at UCLA, which depending upon the year, somewhere top 20 business school in the world, I've had to unlearn a lot of things to run a startup effectively. And so maybe talk about that as because you've worked in startups, right? And how did some of that unlearning process in the clinic translate into unlearning on the startup side?
It's such a good call out, Steve. when we're clinicians, we're taught this very top-down leadership style. You're reacting to the system, whether it's your manager or the physician, and there's processes that are over-engineered at times, and you're just a lot of times you aren't given the freedom to make those changes. At a place like Hopkins, it's a little bit more free because you have that opportunities, but you're not going to have that always. So you need to carve it out and create it. Frankly, you need to be a part of volunteering for some of these work groups that are opening up new initiatives or doing research. Athletico is a great example of one. They've got all these kind of core groups that you can plug into and do some real research or do some proactive outreach and kind of changing the care paradigm for across the system. And I know that's probably true of ATI and USPH and the others. But anywhere you are, you can take that leap and you can approach it. But to your point about unlearning, I think that's such a true statement. When I went to a startup at Recovery One, this is a really crucial point I'll make. It was a clinician-run company. And so the clinicians are taking their experience from the in-person world, that top-down leadership style, a lot of structure, a lot of risk aversion, a lot of unwillingness to take risks because of the consequences associated, which makes sense in where they're coming from. And when you go to a startup, you have limited resources, you have financial constraints, you have time constraints. You're building what they call an MVP, which if you're a clinician going into a startup, you probably think that's most valuable player. It's not, right? Minimally viable product. And oftentimes you're not even starting with that. You're at 0.5 of an MVP when you're really ready to go to market. So it's really going down and working on finding the essence. I know as a clinician, you're trained to laterally think and you're kind of running through the permutations in your head of all the options. When you're moving into a startup, it's really about getting down and communicating across audiences the essence of what you need. You have to, there's a saying, and I forget where I'm referencing it from. One of my executive coaches told it to me, was simplicity is the ultimate complexity. And so when you're communicating, when you're designing, when you're ideating, anything you're doing in a startup, your goal is to get to simplicity. And you have to peel away some of those barriers. A good one is, we operate in a very risk-averse world, and so we're used to following everything by the letter of the law. Well, when you talk to some of these, bigger digital healthcare laws, like McDermott, Will, and Emery is a good example of one. Shout out. They will tell you that, listen, this is not black and white. There's interpretations, and it's the size of the startup. It's the operation of where you are in terms of scale. It's the likelihood of enforceability in that jurisdiction that you need to be aware of, because there's trade-offs. You can be super risk averse, but that's going to slow you down. That may not meet the needs of where you want to go. And it's also going to bog down your processes, bog down your ability to innovate. So I would say that's a big one.
I like that. And yeah, there's a couple pieces there. And I know we're coming right off of, Friday, the Supreme Court came back and struck down Chevron doctrine, right? Which I don't know what that's going to do for the health care and health tech world, but all of a sudden gray area now has to get decided by courts, which you even look at just for the remote therapeutic monitoring coach, right? Those are vague. Those are very vague. What is a day of data exchange? What is a day of monitoring? Even what is a software as a medical device, right? And what level you need to play within there. And I know that's niche to us, but you're 100% correct in that as you get into it, you realize there's a ton of gray area.
Yeah. And they're intentionally gray at times, right? You can't build out an RTM process when you don't know how RTM is going to operate. So you've got to be
what the impact it'll have, right? Yeah. How's this going to work? Who's going to benefit, right? Exactly. Okay, well, musculoskeletal, okay, let's keep it pretty broad, because I bet when CMS put that out, they had no idea. They didn't think that, stroke patients like we see are going to really benefit from this. And vertigo, okay, it makes sense now, right? But give the tools and let people go. I really appreciate you highlighting the work groups. We've hit this on a couple episodes, but in general, having a just being willing to risk your time is extremely important as you look to become an innovator in any world. And at Deloitte Consulting, we had what we called nights and weekends work. So your client work was during the day and night too, quite often, and then and then you had nights and weekends, right, where you work on recruiting. For me, it was one of my favorite projects that I did was actually rolling out Tableau and training like 10,000 people, which was an absolute blast. But like, that was a
I've
risk.
heard that before, that rolling out Tableau is an absolute blast. But I appreciate that mindset. I like that.
I learned a lot. I learned a heck of a lot, and a lot of that experience is extremely helpful now because you learn how detailed certain things need to be, especially when it comes to rolling out software, right? Like, and if you try to do it at scale to where you can't be in person, like, a lot of those lessons. And if it wasn't for doing that, it would be a lot tougher. Like, this job would be a lot tougher. And we wouldn't have been able to bring a lot of that in. So I really appreciate that piece of advice of looking for and volunteering for work groups. And yes, it is extra work, right? And you don't have to do it, but don't complain you never got a chance if you weren't willing to risk your time on something.
Yeah, one of the things that a life worth measured is something that's kind of just come up in my zeitgeist over the last few years, and people measure their life in different ways. Some is, how much money you make. Some is, how many kids you have. Some is what job level you got to. And one of the interesting ones I think that probably resonate with at least the clinicians in your audience, for me at least, it really switched from, accolades and finances to number of lives touched.
Yep.
And so the really cool thing about where I went from, and it really motivated me at an early stage, is I was doing one at a time when I was in the clinic. And that was great. I got to see real change, real make that connection and be able to impact for that one person. And that I can carry with me into my dying day and say, yeah, I made a difference in that person's life. But after working at Recovery One, I've made a difference in 100,000 lives.
Yeah.
And that's going to continue to scale. So if you can make the changes, the MICU studies, then God's been way more than that. If you can make those changes and see the quality that you're creating, and if you're galvanized and driven by the lives that you touch, this is a no-brainer. It gives you that purpose to step into those opportunities.
I love that. I did probably take that calculation a step further, right, and do quantity times impact, right? Like, how much impact did you deliver to the lives around you? And yeah, I think it's a great question for folks to ask themselves and come up with their life measurement, right? Like, how are you going to measure at the end of the day? And at least speaking for myself personally, it won't be accolades. It won't be exits or fundraising achievements or anything like that. For me, it's really, especially about the teams that I work with. It's how many people did I enable to move faster than they originally thought possible. Which I actually kind of want to loop back around to, you mentioned Recovery One was very clinician driven, right?
Early days, right?
And one of the reasons we've found success is we filled all three corners of the triangle, right? So we have business, tech, and clinical with the three co-founders. So myself, our chief clinical officer, and our CTO. As you look at digital health or really just any like health tech opportunities out there, do you now have a framework for how you would look at opportunities based on like leadership structure, or now that you've seen a few, right, and been a part of it, how do you think about an optimal leadership structure or founder structure?
Yeah, it's a good question. And I wouldn't say I've got it nailed yet to what perfection is, but a couple nuggets. One is culture eats strategy for breakfast.
Yep.
So if you're going into an organization with a strong culture and you're surrounded by people that are mission driven, have purpose, and you generally will get along with, you're going to go far. That organization is going to go far because you've got the right culture and you've got the right mentality in place. I mean, again, let me qualify that. I mean, you could have a culture that's great, like you're playing ping pong on Friday. That's not really going to cut it in the startup. But if you've got a high performing culture
Yep.
that has purpose, you've got authenticity that aligns with your values, transparency that helps really share the direction between the team members. You're able to bring your whole self, and you've got that on a bedrock of trust. For me, that's a recipe for success in the companies you're looking for. And I would say above anything else, above role, above space, the culture should be the first thing you look at because that's where really the make or break points are.
I think that's great advice. And I like authenticity, transparency, trust. There's a book right now
and
I'm
grit.
reading.
Grit's the other secret sauce there, the grit.
Thank you for listening to this episode. This would not be possible without the sponsorship of SaRA Health. SaRA is the relationship operating system for physical therapy practices, driving better patient outcomes, improved arrival rate, and improved financial margins. If you'd like to learn more, check them out at SaRA, SaRA Health.com, SaRAHealth.com. And if you'd be interested in advertising with us and helping us produce even more great stories, please let us know at Steven@SaRAHealth.com. Now, back to the episode. If you don't mind, I haven't done this before, but this could be fun. Might be a terrible idea. We might have to edit it out.
Let's do it.
But like ping pong back, right? So a question that I would think to ask about grit is asking about the struggles of the company, right? Because that's going to show you if they have grinded it out, but also shows authenticity too, right? Because it's like, oh, it's kind of always been pretty great. I'm like, I doubt that.
Yeah, I mean, I like that. I think I always ask, what are the challenges? What's my favorite one is what's keeping you up at night?
Yep.
What are the opportunities? And where if you dial in, always dial in a layer below that. Why are these challenges being faced? What would it take to reach those opportunities? And that at least has always given me a sense of, is this person thinking about it right? Are they asking the questions? And are they putting in the work, or are they sitting here and just complaining about it? And it takes all types, but I think I think you're spot on with that question. Another one is it's a broader value one, but I think it leads back into grit. It's what's the greatest accomplishment of your life, and I never put restrictions on it. It could be professional, it could be personal, it could be whatever it is, but what has been your greatest achievement in your life? And what it gives me when I ask that question is, what do they value? And you can dig in beneath that and get into any other one of those. You can get into authenticity, transparency, grit, but it just gives you the ability to really get a picture into who they are and what they value. And that immediately is going to give you a sense of, all right, can I work with this person? Do we have values that align? Do they align with the mission and vision of the organization?
I love that. I want to take a quick sidebar. Your advice on digging to the second level and even third and below is so good, right? It is so key because you're going to figure out a lot in that question. I know for like Amazon, when I interviewed with them back when I was doing the MBA, that was part of their process, right? They picked a bullet. And like, okay, you delivered $10 million in savings. How? Like, by negotiating to this, and this. Okay, with who? Like, it's mainly these suppliers, but also filtered down to this. Okay, and how did you do it? This process, da da da. But it's very obvious what they were doing, right? It's like, if you couldn't answer that question, that second or third level, then you probably weren't the one that did the work. And I think, on the transparency, a question that I love getting asked is what are your key metrics and where are they at, right? And so asking that question and then seeing what the answer is to that, right? And I'd say some red flags would be if there's not a good answer, right? Or like they come up with like 10
I don't know any
things.
metrics. What KPIs? What are those?
Yeah. That would be red flag number one.
Uh-huh.
Red flag number two would be, oh, like we're not told, or we don't know, or whatever else, right? As far as how you're tracking against that. But what for trust, because that's an incredibly important trait, right? What are some ways that you find to tease out the trust level in an organization?
I think one of those is just observing how they're interacting with you, right? Are they guarded? What are their mannerisms? Is the person that's open or a person that's closed off? If it's a person that's closed off, you're going to need to, work with them on developing that trust. If it's a person that's open, it's a little bit easier. It's a little more flowing. And you can probably dig a little deeper. One of the things I'm always sensitive to, particularly when I'm stepping into a new role, which is really prescient for me now, is, what are the ways in which I can best serve the dynamics of the situation? So taking in all the intangibles. What are the motivations of the person across? How am I showing up to that person? What are the goals that we are trying to both head towards? And how can I gauge myself to achieve and serve that situation that leads towards the company's best outcome? And that to me, in any situation, particularly an interview situation, is super important, because then what you're allowing yourself to do is to gain insights into who that person is, and not the old trick, you have two ears and one mouth. You want to get as close to this working and less this working in that process. So being there to really be an active listener and trying to understand how that person operates. So that to me is really important. The other thing I'll just add to trust, and this is, I think, is just a key consideration across the board, whether it's interviewing or in the company at all. It's understanding the hard times are going to come. Asking about the hard times, the challenge we talked about, is a key part of that in the initial part, but understanding the hard times are going to come. It's important to build the trust in the good times so that's there in the hard times.
Yep.
Every startup faces it. SaRA's already faced it. You and I have talked about it. Recovery One certainly has faced it. Kandu is facing it at times. Everybody faces it. So you got to build that rapport. You've got to have that relational connection. I'm a guy that I don't know if you know the DISC profile.
Oh yeah,
a little inner. So I'm under the D section of it. So the domineering piece of it is my base trait, and so that correlates to me being very task oriented, me getting stuff done, and I've had to really round myself out and focus more on the relational building, because not everybody's going to respond to that, and understanding what those other motivations are in the teams that you're working with. It's great if you can be able to kind of plug into them and help them operate better because you're seeking to understand. And that's your role as a leader. All of that to me is what fosters and develops trust.
And you hit on another piece of understanding how you come across to others. And there's a founder, his name's Ray. He and I have had a bi-weekly founders therapy together for like 4 years, 4 or 5 years. And one of the things that he came up with when he was having trouble with some of his developers was putting it in their words, but I think it applies extremely broadly. And that is, what is the user experience of working with you? And actually thinking just actually thinking through that piece of it, and how you come across to others, and how you may want to consider rounding out, right? Maybe some development areas there. But when you said how you came across other people, remind me of thinking through what the user experience is of working with you, and that could be you as a clinician in the clinic, right? Like, what is it like for a patient, both during and in between visits, right? Are you asking them to email you, call you, text you, and then not reading or using any of that data, right?
That's a great call out, Steve. I think clinicians are so guilty of that. Like, they never come to my clinic. And it's never really that internal look of like, what can I do better to provide that value to that patient? Like, there's the missing piece. And I mean, part of it's just because we're all burnt out because we're working in an
Yeah,
environment where we're seeing too many patients and have to document too much. Like, I get it. But if we really want to make a difference, we've got to get in the mindset of that patient who we're serving. Be
yeah,
that, be that servant. It could be a servant leader, could be a servant provider, whatever it is, recognize that you're there to serve the situation, the constituents around you. It's not the other way around.
yeah. I've been blessed by I think serve is a great word in terms of what the amazing PTs in my life have done for me to get me to 100% and even further than that. But yeah, and that doesn't always mean doing more, right? Sometimes it can mean doing less, right? Like
Mm-hmm.
if you're not gonna use that data, don't ask for it,
Totally.
right? Like
Totally.
I'm getting PT right now, and
You're back at PT again, Steve?
of course,
Oh
I gotta
man,
just
you're just like plug and play, man.
I it's not if it's when
Your
and how
PT
often
clinics,
each
like, they could
year.
probably just have a one-man shop serving you, man. It'd be great. You don't need anybody else.
At some point, that might actually be cost effective for everybody. And I appreciate it. It's like, oh, text me and let me know how X went, the flight, whatever it is. And then I did it the first time and I didn't get a response for like 3 or 4 days, and I'm like, I'm not doing this again
Oh yeah.
because of
Mhm.
it. And it's like, just don't ask, right? Like if you're overextending yourself, just don't ask. Like, if she had said, hey, write down in your notes app like how you felt on these days, and then we could talk about it when you come back in the next time. Perfect, right? Now they'll be rolling out SaRA in August, and that won't be an issue anymore. But for now, right? Just thinking through, I just yeah, and especially when you said understand how you come across, like understand the user experience of working with you,
Totally.
and the pros and cons of it. It's great advice. I want to pivot a little bit here because I think you've given a lot of really good tactical pieces of advice, right? From being willing to raise your hand and to risk your time, right? Putting yourself in an environment that is tough and where school very well may not apply, and coming down to questions to ask to find that right culture fit for you. All really good stuff. And so I want to transition into my favorite question to ask, which is, if you had a magic wand and you could fix one thing about PT, what would it be?
Yeah. I think it's such a hard question to answer because when you think about PT, what is PT?
Oh,
Right?
oh,
You have to ask that question, like, what is PT? And I think if you ask that to 1,000 people, you get 1,000 answers. It's
yep,
not something that's easily defined, although the APTA will tell you that it is. And they do a great job putting it on their website. But it's not lived, it's not breathed, it's not in the DNA. And so I think if I was to have a magic wand, I think I would find a way to reach the hearts and minds of every PT on the planet and have them unify on a clear vision and mission for what it is we do for the world. Something that's clear and simple and that we can interact in, that absolves territorial considerations, that really is in service of man, really, or woman, or people. Should be more DEI sensitive than that in this conversation. Um, so really just giving us it kind of goes back to that earlier theme about simplicity is the ultimate complexity we talked about,
yep,
I think, before we got in this podcast.
yeah,
We can rattle off a million things that we do, but we really can't boil it down to the essence of what it is we do, how we make a difference that's universally applied. That to me, I think, is really where we need to get to in a way that speaks to every PT in their deepest core. So that instead of being frustrated by the things we don't have, like enough time with patients, enough time to finish your documentation, enough time to, enjoy some of the things we want, enough money to go and, feel like we've been able to pay off our ridiculous student loan bills. Um, And we do more like, okay, we got into this for a reason. It wasn't to make money. It wasn't to, get accolades. It wasn't to have stature. It was to help people.
Yep.
And giving everybody the permission to go back to that in a way that provides meaning and purpose to them and where they are in their life. That would be the magic wand. I know it's a little bit softer than you probably wanted, but that's I think where it would have the most impact and change in my mind. It's like let me add one more thing, Steve, before you open it.
Yeah,
it's like Simon Sinek. Start with Why. If you've read that book,
yep.
Simon Sinek. But Apple is so successful because of their why. A lot of companies start with the what. Having the why, having that vision, having that understanding of where we're going and why we're doing it, and always correlating that into everything we do. That's the way that PT becomes what it's supposed to be. It's not there yet, but that to me is the straightest path there.
I really, really like that answer. Actually, no, I love that answer because, and to equate it to startup advice as well, a bad pitch deck or sales deck tells you all about features, right? Like, and yet that is exactly how people talk about PT. It's the features, right? Exactly. Like, we do this, we do that. Like, what is physical therapy? Oh, we do dry needling. Like, oh, okay. But why do I want that? Or like, we can treat stroke and musculoskeletal and this and that and this and that. And like, I think you're hitting the nail on the head on the problem of not having a clear definition. And it's funny that you said that about the APTA was in that the mothership. Really nice building.
It's a nice building. They did a great job.
It's a really nice building. It's a really nice building.
Are you doing you were there for the Pearson thing, right?
Yep.
You gonna give Recovery One a plug?
Absolutely. I forget who was there from the team. I think there was maybe Alice. Maybe
Allison was there. Yep.
Yep. I think we briefly interacted. But one of the things I asked Justin Moore of the APTA was, hey, with this report coming out and like it being pretty darn good for in-person PT, like it definitely didn't hurt in-person PT, right? But also showing the different entry points are good for different people. Like, okay, now you're broadening, right, the aperture for folks to enter into physical therapy. Like, do you think it's a good time to do a rebrand, like, of what even is rehab? Like, should you even say we're physical therapists, or should you say we're rehab professionals, or should you say we're movement health professionals? Like, do you think it is like, and in his his response is pretty much like, no, I don't think so at this time. And I don't necessarily disagree with that, but I think, in a similar, there's this itch inside of me that's like, man,
if not now, when is the right time, I guess would be the question I'd follow up on that one.
I guess after the water has gotten hotter, to use the boiling frog analogy, maybe, maybe after Sword IPOs and has a higher market cap than ATI. Or a couple of these others combined.
They already do, don't they? They already do. They're already worth more than ATI, I think, at this point.
That's a good point. It hasn't survived the public market yet, but yes, I think the actual like dollar value is you're absolutely right. And then I even start thinking, now I'm not a clinician, right? But it's like, okay, well, if you did do a rebrand, and this will be fun, right? If you did do a rebrand, would you open it up? And this is specifically, Sean's point of view, right? Would you open it up to OT and speech? Like, how would you put even the guardrails around what physical therapy, or like, even if you just said, okay, it needs to be more than physical therapy, it needs to be rehab, right? Like, who goes in that who gets on that train?
Yeah, and that brings up a really good point. So I'll answer it in two ways. One is I think you go broad.
Yep.
I think that's the right way because you need to appeal to a large audience. And I think constituencies be damned at that point. Like
Yep.
nobody else is really paying attention to that. Like it's all handled with the legalese in the background anyways. So the vision and the marketing claims that you're making, as long as you're relatively smart about it and don't do anything that's apparent, that's overstepping bounds, you've got a lot of freedom. And so I think you're touching upon, kind of being a movement disorder specialist. It's not the right naming of it,
Yep.
but that's the right path. Like, movement, motion is lotion is an expression that an old mentor of mine used to say. And it's not wrong. Movement's the fifth vital sign. There's companies out there, and I won't add more plugs because I'm sure you're gonna have to deal with that later on. But there's companies out there that are tracking movement in ways that are ubiquitous.
Yep.
They're in the phone in your pocket, and we're getting really good insights into gait dynamics, and that has a ton of implications across the board in terms of how we think about overall health. And
Absolutely.
so if we can help to become the catalyst for that, we're the movementologists or whatever the branding is, that we're focused on getting you moving, on your terms, whatever the catchphrase is, it's going to allow us to tap into something that will transcend classes, transcend demographics. It's going to give us that ability to really expand out. And then coming back around to your question about who should be involved in that, I'm not a fan of this territorial war that we see.
Yep.
It's bureaucratic. It's red tape tied to politics. And I think we should go with an open hand to other organizations. If OT and speech want to play a part in that, I think it's better for us. I think it's a bit like akin to, we're speedboats in an ocean, and, more speedboats equals more ocean for us to cover.
Yep. Yep.
And that, to me, when you look at some of the lobbying bodies that we're going up against, having more butts and seats, having more impact from those organizations working with us, and maybe broader, maybe bringing in kinesiologists and, God forbid, personal trainers, like plugging them in, who knows? But getting the shaking off some of that that self-entitled, viewpoint that we kind of get when we're coming up through training, and just focusing on what is the best for our patients, what's best for the common person.
I like that view, and you've got me thinking, like, is there even a word? Because I have struggled to come up with a word to be able to describe what SaRA helps facilitate, which is, if we help providers deliver more care in between visits, right? But like, even what is that? What does that mean, right? I don't know if there's a word in the English language. Maybe there's one in a different language, and then I would love to use that, right? But there's recovery to get back to baseline, and then there's, whether it's optimization or increase, like whatever. But like, there's no word that talks about going from injury to being better than you were beforehand, right? Like there's, at least not to my knowledge, and like that's what I would want it to be called, right? It is something that shows the spectrum of possibility, and because it's not just from recovery back to baseline, right? It's not just, hey, you tore your ACL and we're going to get you to be able to pass your return to sport testing, and that's it, you're done, right? It can be, but it also can be, hey, we're also going to bulletproof the heck out of both knees and some other things, because now we see this and we're going to, be able to augment you even further physically, right? So like, I don't know, there needs to be a word. Maybe that'll be my contribution.
We could call up Pepsi and see if they're willing to spend their $2 billion on developing the brand for us. I think you're right. There needs to be something simple, right? Some kind of simple imagery to connect to that. But if you're whatever the word is, if the why beneath it is able to translate into the everyday consumer, and they get value, they get quick real value that they can measure in their own terms, the rest of it falls into place. So that's why I kind of go back to the word something, but the why is everything.
Yep.
And that to me is where I think we as PTs, we as healthcare practitioners that care about these people that are going through musculoskeletal or neuromuscular or respiratory, pulmonary, cardiopulmonary, whatever avenue we're in, really need to tie into and spread that word, spread the gospel.
Well, we're dropping that challenge as a part of that. So yeah, what is that why? And who knows? Maybe there will be some new alliances forged and a few other things over the course of the next few years, because it seems like it's going to have to, based on the private practice owners we talk to. It's something's going to have to change.
It's one of those things. It's interesting. We with Recovery One, we approached private practices. We talked to everybody. Large, medium-sized players. Early days, because I always thought hybrid care was the right way to go, and we took a very proactive approach to it. And what we saw more often than not is we're not feeling the pinch enough to make the change yet. You're more of a threat than a value to us.
Yep.
And I think that's starting to change finally. I think we're starting to see a realization that, reimbursement through fee-for-service and brick and mortar settings, you can't just keep throwing bodies at it that are doing, instead of 30 minutes, 15 minutes, and you're adding, 7 people on the floor. That's not going to sustain itself anymore. And so I think we're coming to an age, at least I hope, that some of these conversations that need to happen will happen. And hopefully you and I will be able to play a role in them and help to steer them, because I think it'll take people like you to really get us there. If it's Tab Blackburn, who's coming out of retirement to solve these problems, we're probably looking in the wrong place. If we're rolling up 2 80-year-olds to make these decisions, I'm not getting political, I promise people. Then we're probably in trouble. But I think we can do better than that as a profession and as a healthcare system.
I would agree. And I did make a joke on that Thursday, because it was also the same night of the debate. It's like, this is the debate I'm looking forward to, is Drew and Caroline, not the other one. So we can get a little bit there. Well, Sean, I want to say thank you very much. Right, I think you've given a lot of tactical advice for folks. Right, so as innovators in the PT world might be looking to find that organization, right, to look at the authenticity, transparency, trust, and grit, and asking those second, third, however many levels you need to get to till you feel like you really have the answer. And then also, don't be afraid to risk your time and go put yourself in a position that's going to stretch you and grow you. And doing, I think those are 2 tactical pieces of advice that everyone can take home. And I want to say thank you very much for the time and insight. This has been a fantastic session, and I think you're going to give some folks some things to grow with.
That's awesome, Steve. I appreciate the time. I love what you're doing with SaRA. I think you guys have got that simplicity is the ultimate complexity thing nailed in your business model. So it's right up my alley, and keep doing what you're doing. This is great. It's been a blast.
Thank you for listening to another episode of The Disruptors. I hope that you were able to take 1 or 2 things away that you can apply immediately to your own innovation journey. As always, I'm your host, Stephen Cohen. This is sponsored by SaRA Health. Let's keep moving.